Dear brothers and sisters, warm greetings from Balaji Vidyapit, popularly referred to as Sbv. I am delighted to meet you all once again through Channel One. I thank you for your continuous support in this endeavor. Universal health coverage sanctifies that everyone, everywhere, should have access to the quality health services they need, when and where they need them, without individual or familiar financing hardship. In essence, it includes the entire gamut of essential health services ranging from health promotion to prevention, treatment, rehabilitation, and palliative care. Universal health coverage has inherent ethics and morality embedded in its rationale, since safeguarding everyone's physical and mental health is fair, just, and consistent with the principles of right conduct and distributive justice. The noble idea of universal health coverage not only promotes health as a fundamental human right, but also confers benefit in a pan-global manner. It relates to the observation that healthy populations are more socially cohesive and politically stable. Also, good health promotes economic well-being, not just among healthy individuals, but also at the macroeconomic level. In order to make universal health coverage a reality, where people actually obtain the health services they need and benefit from financial risk protection, the most essential requirement is universal access, which itself has three dimensions, that is, physical accessibility, financial affordability, and acceptability. Physical accessibility refers to the availability of good health services within reasonable reach of those who need them. Moreover, the physical accessibility should be backed by well-established service and philanthropic organizations. Financial affordability is a measure of people's ability to pay for services without having to confront financial hardship. This includes direct and indirect costs, such as transportation for availing health services. Affordability is influenced by the wider health financing system and by household income. Acceptability is people's willingness to seek services. If people perceive services to be ineffective, or people do not seek services due to social and cultural barriers like language, ethnicity, religion, gender, etc., then acceptability of health services is low. World Health Organization and World Bank offer a simple universal health coverage index that is useful for inter-country comparison. This index essentially focuses on four categories of health indicators, namely reproductive, maternal, and child health, infectious disease control, non-communicable diseases, and service capacity and access. International Universal Health Coverage Day is observed on 12th December every year and strives to raise awareness of the need for strong and resilient health systems and universal health coverage with multi-stakeholder partners. It also helps to enhance awareness about millions of people still waiting for help, champions the achievements and calls on leaders to make bigger and smarter investment in health and encourage diverse groups to shoulder commitments in order to help move the world closer to universal health coverage. Our Honorable Prime Minister, Sri Narendra Modi ji, has launched the world's largest health insurance scheme, namely Ayushman Bharat, for ensuring quality universal health services for our countrymen without any bias whatsoever.
Hello everyone, I am Dr. Abhijit Vinodrao Boratne, Professor and Head Department of Community Medicine from MGMCRI Sbv Pondicherry. Today I am here to talk regarding Universal Health Coverage Day 2022. As we all know that every year on 12th December, this day is celebrated all over the world, and this day reminds us as well as our leaders and stakeholders to make smarter investment and accelerate all the activities to provide health for all. Why we need actually the UHC? Because the data shows that 930 million people are spending more than 10% of their earnings on the healthcare services, as well as every year around 100 million people are pushed to poverty because of out-of-pocket expenditure. Moreover, half of the population in the world is not having access to quality healthcare. So, we have some importance of this universal health coverage, which can lift people from poverty. They can provide all these health services very nearby to their residence, and it also can provide the community from public health crisis and will move towards the universal health coverage. This year the WHO has given the theme like build the world we want, a healthy future for all, and it is giving the emphasis that to build a stronger health system, we do require few things. Our system should have few principles like equity, trust, healthy environments, investment into health sector, as well as accountability and political will. To provide universal health coverage, now almost all the countries, they are planning their activities, they are planning their strategies, preparing the policies. Their all activities are towards the universal health coverage. WHO also identifies achieving this universal health coverage as a strategic priority to provide healthcare services accessible to all, almost 1 billion people by the year 2023. We do have different type of health system in the world, like fragile health system where it is just developing, they don't have much more resources. So what they are doing is like they are building the different services network and building the institutions for providing the healthcare services. The other part where the health system is good, doing well, there they are preparing the policies, they are engaged into different dialogues with the administrators and the policy makers, and they are strengthening their network. What are the things which we require to provide UHC? We require the guidance from the stakeholders, we do require the agreements from the government, non-government, public sectors and the NGOs. We require the large amount of data which will come from the resources like research and innovations. We require the leadership into diplomacy and the advocacy. We also require certain principles to be followed like gender equality, health equity, as well as human rights, intersectoral cooperation as well as integration to have the proper network to provide all these services. Every government all over the world is trying too hard for providing the universal health coverage, and in this they are mobilizing all their resources and they are doing as per their requirement, as per the resources available with them. But emphasis is on the importance of accessing the health coverage whenever these people are in need of as a human right. We have also involved ourselves for providing the universal health coverage.
Greetings from Balaji Vidyapeeth. Balaji Vidyapeeth, which is accredited with the highest possible grade by NAC, namely A++, has been largely focusing on experiential learning in the realms of health professions education and practice of healthcare through the power of evidence-based research and discerning knowledge. The Chancellor Shri M.K. Rajagopalan and Vice Chancellor Professor Subhash Chandra Parija firmly believe that the students and faculty are the torchbearers of tomorrow. This student and faculty-centered philosophy has ever been the propelling force and is firmly embedded in the ethos of Sri Balaji Vidyapith, popularly referred to as SBV. This philosophy and theme, envisioned by these visionary leaders, was transformed in the year 2019 into an international health research convention where the strength of research, practice, and innovation-based knowledge was shared with the community in need in order to shape a brighter future for our nation. Following a lull due to the pandemic, the second International Health Research Convention has now arrived with a big bang. It will be held from January 20th to 22nd, year 2023. During this impressive convention, 24 workshops, 15 conferences, and 7 CME/symposia would be held that would quench the academic and research thirst of the avid delegates. The events would be held both at the main campus situated in Pondicherry as well as the off-campus near Chennai. This mega venture is propelled by none other than our Honorable Vice Chancellor Professor S.C. Parija and ably supported by Professor P. Karthikeyan and Mrs. Asha Suresh Babu, senior functionaries of Sri Balaji Vidyapith. Our Honorable Vice Chancellor Professor S.C. Parija leads SBV from the front. This is manifest in the latest feather that will be acceded to his colorful cap. Professor Parija will be honored with the prestigious S.N. Bose Birth Centenary Award for 2020-23 by the Indian Science Congress Association. The award will be bestowed on the 7th of January 2023 at the prestigious 108th Indian Science Congress to be held at Nagpur.
The goal of universal health coverage has become more attainable as the world has become richer, leading to greater access to health services and technologies such as vaccines and antibiotics, and to the most dramatic decline in poverty ever achieved. This is a reflection of social and economic progress and of the recognition that population health is both an indicator and an instrument of national development. Yet, the financial cost of massively expanding access to healthcare globally is a formidable barrier to achieving universal health coverage. Technically and economically, efficient approaches to the achievement of universal health coverage include the use of electronic media records, telemedicine systems, digital monitors for drug adherence, and clinical decision support applications, screening for risk factors and early signs of disease, and expansion of the quantity and quality of human resources for health at the physicians, nurse, and community health worker levels. Also required are efforts to effectively address social and environmental determinants of health, such as health education campaign, access to safe water, control of tobacco, and the unsafe consumption of alcohol, road traffic safety, expanding enrollment in high-quality primary and secondary schools, and more equitable distributions of income and wealth. Health promotion and disease prevention is a major factor for universal health. Among the goals of health promotion are to ensure a health literate society with the ability to obtain, process, and understand basic health information and services needed to make appropriate health decisions and follow instructions for treatment. Policymakers, health promotions, and disease prevention specialists and healthcare providers have important roles in health promotion programs holistically. Ensuring health promotion requires a five-pronged strategy which include building healthy public policy, creating supportive environments, strengthening community action, developing personal skills, and reorienting health services. I wish you the best of health. Do remember to continue practicing physical distancing, wearing masks, and strictly adhere to hand hygiene. I wish you a very happy and prosperous new year 2023 that brings good health to all of us. God bless you. Jai Hind.